the designated public comment. So this is a special meeting, so thank you everyone for coming kind of last minute. But the Department of Behavioral Health is working with the Mental Health Services Oversight and Accountability Commission, along with 4 other counties, which are Shasta, Mariposa, Monterey, and Orange County, to get the approval for Psychiatric Advanced Directive Innovations Project. And so Fresno County is requesting an additional $500,000 to be allocated to our innovation project budget. These changes were introduced at our April Behavioral Health Board meeting, which opened a 30-day public comment period, and the department did not receive any comments. So Ahmad, I will pass it on to you for the presentation.
Thank you, Kylene. I'm going to try to share my screen just so that might make it easier for people. Hopefully it works for the PowerPoint, and it's just quick. It's just a couple of slides, so it shouldn't be anything. Are you guys able to see that yet? Yeah.
Yes.
Okay. So as Kylene noted, this is a public hearing and also behavioral board hearing to be able to finalize our efforts around basically amending our current advanced psychiatric directives project. So I want to thank you guys for allowing the special meeting. This was more at this point of a formality because we complete all the process and then we forgot, myself and my team, we forgot to get back on calendar for the behavioral health board to be able to do a final approval. And so by the time we realized the error, it was the weekend, and then Monday morning we were like, well, can we get it on the agenda? But the agenda had already been set out, Brown Act requirements, things like that. So it was just not, we were not able to get it on for the June meeting. And so I appreciate the flexibility of the board to allow us to get this done. So I'll go through this pretty quickly. I think as Kylene noted, it's been about, our Fresno's plan was approved in 2019. We had started doing some minor work during the end of 2019. We had a big kickoff meeting in February of 2020, where the Sachs Institute, the Blatt Institute, some folks from the OAC, I kind of had a convening to see how we were, and Lori Hallmark, to see how this project would move forward, identifying some populations. I believe Orange was on the call, and I think at that time, Modoc County was interested, and so they had actually participated in that. And as you all may know, within a couple of weeks, we went into we started to experience the full-blown impacts of the global pandemic, and so we went into a shelter in place. Everything kind of stopped, and so that project stopped at that point. This past year, we've been trying to do something with the project and move it forward, but our big challenge had been, without having the other counties on board and really knowing, well, what is the statewide? We knew how we wanted to test it out locally, but without a statewide kind of goal, it was hard for us to move forward because we didn't know what's going to be the project, what's the technology that's going to be used, how are we going to do it, what are going to be the costs, evaluation. So we kind of were in limbo for really about a year. And now, as Kylene noted, we do have those counties, Shasta, Mariposa, Monterey, Orange, coming on board. And so we have now a semblance of what the project is going to look like on a larger scale, which is statewide. What are going to be the costs? Who's going to be paying for what amount of the various projects? And so with that information we saw that we were going to need probably some additional money if we wanted to really do the project the way we're all intending. And also in order to make sure that we locally are able to do some of the things that we wanted to do as well. So with that said, we looked at what was the fees, the viability of us doing that. We did have $500,000 that, if it wasn't allocated to a program next year, would be up for reversion. And we didn't want to create a program next year just to spend the $500,000. It also takes, as you guys are aware, months to develop those. So an option we thought is we could utilize the money that is already set for reversion, because it's not allocated, to help expand this program, and not really expand it, but really bring all the parties into play. So I'm going to go to the next slide. So originally we when we had proposed, or when the OAC had presented this as a project they were supporting, and asking if counties were interested in participating, we had brought that um, to the board, to the stakeholders, and it was something that a lot of people were really interested in doing. And at the time, we were facing reversion once again. Um, and so we basically put the maximum amount that we could at that time that we had available, just under $1 million, and that was subject to reversion to be able to do the project. Not really knowing what the total cost of the project would be in the long run once everybody was involved. And so now that that is kind of shook out a little bit more, we have a better idea of what it would be. So the money we're using is not all the money for reversion. We're actually using 500 of $600,000 for this because that's what we felt we needed in order to make our part whole in this project. So what we're looking at doing is amending basically our innovation plan and asking the Mental Health Services Act Oversight and Accountability Commission to increase our total project by $500,000, which would bring the project to 1,450,000, which would allow us to cover really what the statewide project is going to be, so that you guys can see just some of the things that the project is going to be paying for. It's for the PADS training and also peer training. It's we wrote into this, and a lot of the work has been done, and thanks to Lori Hallmark from the Texas Rio Grande Legal Aid, really making sure that PADS is something that involves peers in terms of um, not just speaking and presenting and educating people about PADS, but also being really the ones that are hands-on involved with helping people develop and establish their PADS. Um, Developing the PADS itself, as we've shared before, California has a type of a psychiatric advance directive as part of its overall advance directive, but people don't know how to use it. It's multiple pages. It really doesn't empower individuals to do it. And so part of what this process is to create a pad also statewide that can be used statewide, that will meet legal muster, that is also empowering the individual in terms of having that pad. So it's less of a checkbox, but how does this pad really help them? Um, One of the things that we has come up is developing a platform for where the pads could live. And I'll get a little more in depth into that. But the challenge is if you have a pad, and let's say it's a paper pad, um, pad psychiatric advance directive, this is great if it's laminated, but if it's, it's like 2 pages, it's kind of hard to laminate and carry around with you. Um, if you have a paper pad, that pad can get wore down, it could get lost, a lot of things. And so how does that individual at a time of crisis, when they may be struggling and cannot really remember where they stored their pad, where they put their pad, be able to tell, that crisis response team, whoever it may be, oh, you know what? I have a pad. Here's who to call. Here's, what works for me. And that's really the whole intent of the pad is in the instances where that person is unable to speak for themselves, that they maybe have lost their own voice during that brief period of time, that they have something that can really support and speak to their wishes. And so the need is going to be to have a system to where you can save the pad, but it also can be accessed. For example, crisis response teams, that it could be accessed by um, emergency departments, first responders, things of that sort. And I'll touch a little more. We did have a good discussion actually in an AMI presentation as for some of the things that people wanted to see with that platform. So that platform has to be designed because there's not a statewide system that really works. And so that's one of the things is to look and exploring that. And luckily, Orange County is going to put up a lot of money to do that. So that's good for us. That all innovation programs require an evaluation. And so there's going to be some of the money is going to go to pay for the statewide evaluation. And the way they broke it down was based on um, who are the larger counties and who's going to be able to take home more. So Orange is taking the lion's share of the cost of the overall statewide project. We're probably the second, obviously county, Monterey's third, and then counties like Shasta and Mariposa that are very small. They don't have a lot of money that they're coming in, but they're paying a percentage of it as well. And then we wanted to make sure that there was money in this project to ensure we could do local efforts. We wanted to make sure our local peers are getting trained. We wanted to make sure that if we're using local peers, those local peers can be paid or compensated for their work. We wanted to make sure, if we need to create incentives, that those are done. We wanted to make sure that, again, locally, that we would be able to make it work for us based on what we had identified as the populations we wanted to at least try to roll out pads with. So just real quickly, as with any of the MHSA projects, once you're making any kind of a drastic change, in this case, increasing it by $500,000, we did need to do a public community plan and public comment process. And so we, as Kylie noted, back in April, Dewan notified your board that we were seeking to increase funding for this project in order to be able to really meet what now the statewide project's going to look like 2 years later. Um, we did have a 30-day public comment period that was posted. We did not, and so this is the part I want to clear. We did not receive any public comments with regards to the posting and the information that was out there. What we did get is we did host, along with the other 5 counties, 5 different public webinars around PADS, and those were some were done for first responders, some were done for individual serve, some was done for family and friends, and I think some of you participated, or at least I know viewed some of those webinars. So we had those as again part of a statewide information process, and so we received comments from those, not necessarily to specifically increasing the project amount, but we did get some great, we were really excited, some peers who are part of our workforce, in our system of care, not necessarily just with the county, who then had messaged us and said, hey, I would love to be involved with this project when it gets up and running. I would love to be a trainer for PADS. I would love to be able to assist with some of those. So in that regard, we did get some positive feedback for the overall project, but not specifically for what we were looking at for the 30-day comment. So the 30-day public comment then ended May 25th. And that's where we should have probably, like around the 26th, reached out to Jeanette, say, hey, Jeanette, can you talk to Kylene and see if we can put this on the agenda for June? And for whatever reason, it's probably May Mental Health Month, or some other activities. We missed it till like last week, and that's when we're like, oh, we got to get this on the agenda. Wait, the agenda's already out. How are we going to add it? So we also had been invited during that 30-day period to speak on a couple of projects that we're working on with NAMI. And during that one, when we were talking about PADS, we had a really great, robust discussion, not just about PADS, but really our stakeholders, not just supporting it, but wanting to be involved and wanting to make sure that, do we create a pad to where a family member may be able to help access? How do we create it to where, and in Caroline, I think you guys were, yourself and someone else really noted the importance of having some type of a database or system where the pad could be utilized and accessed, but it also being user friendly enough to where you don't have to have, a degree in computer programming to be able to access it, but it could be very quick, easily be able to go in and check or update or and that's the big thing is making sure the pads can be easily changed. If someone's like, hey, I want to add someone to my support system, that it's not a whole process to do it. They could hopefully go in real quickly, add the name, upload it, update, releases of who could, be involved or things of that sort. So those were some feedback we got, but they were more specific to, I would say, the PADS project, which we've tracked and documented, but not really as far as any comments as far as, yeah, go ahead and increase the project, or no, we don't want to increase. So there was really not a lot of feedback, and that just a lot of positive feedback about people in this project. And I think finally after 2 years it moving forward. So really the next steps, and I know, we'll have a public comment period coming, but really the next steps, what we're asking from your board is approval to amend our project by increasing the total project amount by $500,000. This will allow us to be able to get approval from the OAC this coming Thursday when the commission hears the proposal for the other 4 counties. Fresno has an addendum in there potentially to just increase our project funding, but the other 4 counties are seeking approval to join that project. So again, what we would be asking for your board would be approval to amend the project to increase the amount by $500,000. And with that said, I will turn it back to you, Kylene, and hopefully answer any questions that there might be with this. And if I can figure out how
Thank
to
you,
stop
Ahmad.
sharing this, there.
I would like to open it up to the board members first. If you have any comments or questions for Ahmad.
Really quick, I know that you said that Orange County was taking the bulk of it in regards to putting together a database system for everything. How much of the 500,000 would be allocated on our end to the database system?
Great question. So they're going to put up almost the entire $8 million for this huge
Okay.
system. So we're not going to be necessarily funding the database, Nick. What we're going to be using is a portion of that $500,000 to actually do the stakeholder process around
Okay.
designing that said database. So it's going to be, hopefully we'll be able to do some things by then outside of virtual, but really being able to bring in, you know, family members, consumers, individuals like that and say, you know, does this work? No, that's too complicated. Or how do I add a release in here? Well, you've got to fill out this form and have your attorney sign it. Nope, not going to work. We need it to be, you know, something quicker and easier. So really, it'll be about half that 500,000 is what we're anticipating to be supporting what is going to be the stakeholder process, and each of the other 3 counties, so Mariposa, Shasta, and Monterey, our part is going to be really doing that stakeholder process to help identify, again, what should the database look like? What are the needs? How did we make sure that it's user friendly? And then Indian Orange will then take those basically specs and have that created. And the OAC is in supporting that because they are looking at then long term, if this database is created, to get legislative funding to fund it statewide, so all counties could then start doing pads and putting their pads into the system.
Perfect. Thank you.
It's a long process, so
Yeah. No, absolutely. I understand. I appreciate it. Thank you.
not a problem, sir.
Do any of the other board members have any comments?
I think
Or
Francine
questions?
had tried to raise her hand, Kathleen.
Francine?
Yeah, I think Francine's trying to speak, but she's muted.
She's not muted. It doesn't show she's muted.
We can't hear you, Francine.
Can she put it in the chat if it's a quick, Francine, is it a question that could fit into the chat maybe?
Or you could always call in.
Oh.
In the meantime, I have a question.
Yes, ma'am.
So did I hear you right that we were up for a $600,000 reversion?
So if we do not have these funds allocated by June 30th, 2022, we would be at risk of having $600,000 reverted. With the approval of this project, we will get 500,000 going to this project. So there will be a matter of $100,000 that'll be floating around, and we're hoping by next year to have some new plans, including maybe the youth project, and we can try to attach those fundings to the next cycle of projects.
Okay, and Francine asked, where does that reversion money come from which project?
So the reversion money is not from any specific project. It's money that is from our innovation pot, the funding. And so we've taken money out of that pot and allocated to projects. This is money that is accumulated over the past 3 years. And so it's money that has not been allocated to a project yet. And so it needs to be allocated to a project or it'll revert. So we're not actually taking anything away from any particular project, Francine, but these are money that just weren't tied into a project. So if you guys recall, in April, we had 2 innovation plans approved, the California Reducing Disparities Project Evolutions and the Suicide Prevention and Follow-up Call Program. And so for those programs, we allocated funding. And if we had, for example, allocated for the Suicide Follow-up Call Program, like this $500,000, we could have allocated to that project, but then our concern then becomes is you're putting a really high cost for that program, more than they would have needed, and then it becomes an issue for sustainability. So then at the end of 3 years, you're trying to fund a program, you know, at a higher level. So we wanted to be really with our projects, really try to hit those projects as far as what they actually cost to operate, especially since they are kind of pilot and learning projects. And so that would make it a little easier for sustainability. And so that left us with about $600,000 that we still have about a year and 2 weeks to spend. But if we're able to add this $500,000 to this current PADS project, then we're only needing to figure out allocating about $100,000, which will probably go into some future innovation projects. And I'm probably not explaining the best physical technical stuff, but Hopefully that answers the question, Francine. Okay.
How streamlined is this in regards to becoming a statewide system? Like how many, I know you said we have a certain amount of counties on board, but to put up, and I think it's a great program, and I went to the couple of the webinars and I think it's great, but how streamlined is it to actually be something that's statewide as opposed to just, select a few counties? Again, Orange and Fresno are large, but I mean.
No, totally understand. Yeah, so this started out as a OAC sponsored project. So the Mental Health Service Act Commission itself was the one that wanted to really explore PADS, and so they had funded like the webinars that you spoke of, Nick. Like they had funded that part, so we weren't paying for those. They were funding those to basically exploratory, like who would be interested. There are several other counties that were definitely interested in it, but they did not have innovation funding available to. So counties, including I know Madera at one point was kind of curious, like we're interested, but can we, afford to do that right now? Amador, Alameda, San Diego, because I believe Lori Hallmark from the Texas Rio Grande Legal Aid that's been working with us has been working with Luisa's team at the Central California Legal Aid Services to have some discussions and how could this work. Was then involved into San Diego's equivalent, getting really interested in that. So there's interest in different areas, but I think as far as funding the kind of like the pilots, a lot of the counties just didn't have either the funding available or their money is right now tied up in other innovation programs. But that's why the OAC wanted to take the lead on it so that they could take at the end of 3 to 5 years this finding, and as a state agency really push it with DHCS and the legislator saying like, we have the PAD document, we have the system, this needs to be legislated as a thing statewide. I think
You're on mute, Nick.
I lost your sound.
I apologize. And so this 500 that we would allocate, this wouldn't be a continuing addendum to the actual budget. This is a one-time deal.
That's it.
Okay.
And for our innovation plans, overall, that when we propose the plan and the budget, they're fixed. It's not an ongoing. So if you say it's $1 million for 3 years, that's all you're approved for. And that's why it's really important, I think, for projects that we use these to truly be learning projects, research projects, and not be used as something that's been done historically by some counties as like seed money because, hey, this is great. Well, how are you going to pay for it after year 5? Like, oh, I don't know. We had $1 million to spend a year the first time, but in 5 years, you're not going to have necessarily that. So, and that's the great thing with this one is what we're working with Lori and hopefully locally be doing is creating the infrastructure and the system so that it can be something that's sustainable.
I am going to go ahead and make a motion to approve the amendment to increase by $500,000 the proposal for the Fresno County Innovation Plan for the Psychiatric Advance Directive.
And I
second the motion. Oh.
I like it. Everybody wants to second. This is good. I like when things are flowing like that.
So I got Nick down as the second.
Is there any further discussion to be made before we start vote? Okay. Do we have a quorum, Jeanette? I believe
Yes,
so.
yes.
Okay. Can we please go through for a roll call vote?
Okay. I'm going to call the members that are here. Kylene Hashimoto,
Aye.
Mary Lou Browdy-Minkler,
Aye.
Francine Farber, and maybe she could put in the chat her vote. Carolyn Evans,
And hers isn't working.
I'm muted.
Debbie Zhang, Debbie Zhang. You're unmuted, so
I unmuted myself. Can you guys hear me?
yes.
Okay.
Okay. Nick Letton,
Aye.
okay, that's 6 votes in favor. And that's a quorum. That's everybody here.
Okay.
Thank
The
you, guys.
motion carries.
Did you get Francine?
She said yes in the chat.
Yeah, she put yes in the chat. And just for your board to know, next and I can send out the info to Jeanette to share with the board if they would like. The commission hearing next Thursday, we're set to present at around 10 o'clock. It's going to primarily be one presenter, and there'll be counties on board if there's questions specifically to those counties. I think the questions are probably going to be more for the newer counties coming on board. But for those of you that have been involved with this, have seen the webinar, are very much in support, you'll be able to, if you want, call in and provide public comment and support. I know there was some, how would you say, there was some opposition potentially from some peer groups in LA County. And I think that had to do with more the way LA County was envisioning pads. They were like, we're going to have everyone that comes in get a pads. And I was just like, yeah, but that's not supportive decision making. The supportive decision making is like, well, Nick, do you want a pad? Do you feel you need a pad? I'm like, yeah. And then you deciding what goes in it, right? And so there was I think that issue, but they were expressing some opposition, and I did not hold my tongue on the call, and I said, well, I don't get why people from LA should be determining whether Fresno or Monterey or whatever move forward with this project. We're not going to voicing our opinion on what LA is doing. So I just didn't feel that, our local stakeholders are supportive. I was like, so why would I? So I'm not going to say that on Thursday. I'll make sure not to say that in a crass manner, but if you have time, you're interested in listening to that, I will make sure to get that link and information to Jeanette, and so that you can listen in and even sign up to provide public comment and support if that's something that you wish to do at that point. But I'm going to stop at that point and see if there's any questions for.
I would like to open it up for public comment at this time. And again, you do have the opportunity at that MHS OAC meeting. And if you're calling in, *6 is to mute or unmute. And the chat box is also available if you're joining online. Okay, I'm going to assume you're holding on your comments for Thursday. So with that, thank you again, Ahmad, and everyone for coming on this Friday. Meeting adjourned. Bye, everyone.
Bye.